Hi, good afternoon, everyone, and welcome to the Imperial Valley ROP Health Industry Breakout Session. This is the first of many that we have to come within the next few months, so we're really excited and thankful that you're all here joining us today. My name is Adrian Gonzalez, and I'm a program manager here at Imperial Valley ROP. I supervise a variety of programs that include youth and adult services, and within those programs, three of them that I supervise are actually certified nurse assistant, certified medical assistant, and an RN mentorship program. So I'm very excited to be the facilitator here today and excited to hear all the feedback that we get from all the industry professionals and guests that we invited. Just a couple of quick housekeeping items. We ask that you please, if you haven't done so yet, sign in the chat box below. And if you can please put your name, title, and the organization that you represent. In addition, we're going to be sending out some industry surveys and evaluations in just a bit in the link in the chat box below. We'll send you those links. Not too much. It wouldn't take too long to fill those out, but we really value the feedback that we get from you guys because we use that for our students and to enhance our programs. Finally, we are going to be having a presenter and a panel with some Q&A questions that are related to the healthcare industry. And we ask that you go ahead and put your questions in the chat box and we will review them at the end of our session. So hopefully you can stick around for an extra 10 to 15 minutes as we go through the questions from our audience. And just as a reminder here, the purpose of this annual meeting is for our instructors, staff, partners, stakeholders, etc., to hear firsthand feedback from industry representatives regarding trends, employment outlook, necessary skills within the healthcare industry. And we share this information with our students as we're providing them high quality training and preparing them for the workforce. We have a full agenda for you today, so I'm going to go ahead and get things rolling, and I'm going to invite our presenter to go ahead and take the floor. She is the Regional Director for Employment Engagement in the Health Sectors of San Diego and Imperial County at California Community Colleges, Ms. Connie LaFuente. Thank you, Connie, for joining us, and I'm going to go ahead and give you the floor.
Oh, I said, thank you so much. It's a pleasure to be here. I just realized I was muted. Okay, I'm going to go ahead and share my screen. Please bear with me. All right, can you guys see okay?
Yes, absolutely. Very clear. Thank you.
Awesome. Okay. Well, once again, thank you so much. I'm very excited to have this great opportunity to present. If you guys have heard me before and shared this information before, I apologize. But this will be a short version, and it's just be a little bit of an idea on what it's being done for our region. As a regional director, one of my main jobs is to engage employers to assess needs, gaps, and opportunities for future workforce. So for the past couple of years, in collaboration with the Centers of Excellence, which is the research arm for the California Community Colleges, we have developed a health sector profile and strategy, and I'm very happy to be able to share that with you today. So we're briefly going to go over what is the health sector, the methodology we used, the trends and recommendations. As most of us are in the health sector, so we are aware that's a very large sector, and it accounts for 136,000 jobs in the San Diego Imperial region. There are over approximately 8,000 establishments in the region, making up 9% of California's healthcare businesses. And this sector is projected to grow by 15% in the next 5 years in the San Diego Imperial region. And it is considered a sector. When we talk about the health sector, most people think of doctors and nurses, but in fact, there are 48 health occupations under all these main categories. Those 48 plus programs are being taught throughout our community colleges. For instance, the nursing category, we have certified nurse assistants, home health aides, licensed vocational nurse, Under emergency medical services, we have emergency medical technicians, emergency medical responders, paramedics, and many others. So in the past 10 years, from 2009 to 2019, San Diego County's population grew by 10%, from 3.1 million to 3.3 million. And SANDAC predicts that the number will increase to 4 million by 2050. During the same time period, the county's 55 plus population, the aging population, grew by 33%. And that's projected that it will grow to be 1 million by 2020. Then, similarly, in Imperial County, we see an upward trend in terms of the population growth. As you can see, the current population grew by 6.5% in the same time period, as well as the aging population grew by 28%. So in both counties, the 55 plus population tripled the rate of growth for the current population. So this means that as the aging population increases, the greater will be the demand for healthcare services, as well as for healthcare workers. So the methodology we used, this was a partnership with the Centers of Excellence, which I mentioned is the research arm for the California Community Colleges. So they started with research. So in 2018, they identified the top occupations with supply gaps by sector and shared those recommendations with colleges for feedback. In 2019, 2020, the regional directors, there are 6 regional directors that do the same thing as I do, but we are all specialized in different areas. So I am the health sector. There are other ones that are like, my counterpart is advanced manufacturing. There's another one for IT and etc. So all of us review our sector analysis and reports, and then we interviewed and surveyed employers to gather more information. After we did that, in the same time period, the regional directors requested to do more research based on the analysis and information that we received. And currently we are in these last 2 areas, which is the sector recommendation reports, as well as sharing this information. And we are in this gray area right now as I'm sharing this information with all of you for feedback. So this is the sector recommendation brief that was developed, and this is primarily for patient care coordinators. And this document includes information collected through research and through stakeholder interviews. And most of the information for this report is primarily for San Diego County. And we are in the final process of releasing the recommendation brief for Imperial County. But even though the data will vary a little bit, the overall sector analysis is the same. And we felt it would provide you with a broad perspective of what is needed at this time. So part of the research was to identify the occupations that are most in demand and the institutions that are offering those programs. So home health aides, medical assistants, and certified nurse assistants are the greatest in demand. And we have 6 community colleges that offer programs of those foundational occupations. And there are 11 private colleges that offer those same programs. If we look at the labor market demand versus labor market supply, we see that there is a supply gap. That means that there is great need for these foundational occupations. If we look at throughout California, there is 17,930 supply gaps for this occupation. When we look at the hourly earnings for these foundational occupations, you can see that in San Diego County, most of these foundational occupations are below the living wage. And when we look at the median hourly earnings, we see that only one, which is the medical assistant, is actually above that livable wage. And when we look at Imperial County, we see that there is and there will be a demand for all these 3 foundational occupations. If we look at home health aid, it is anticipated that will be an increase of 85% in terms of jobs by 2024. And same as for the nurse assistants, 25% increase, and medical assistants, 17% increase by 2024. And we see, this was very interesting to me, that the hourly wage for a single adult in Imperial County is around almost $10. And right now, those occupations are actually paying a little bit higher, which is very interesting because in San Diego, it's the other way around. So as part of research, I conducted stakeholder interviews and focus groups. And this is an example of the healthcare facilities that I engaged to validate information. It is important to mention that some of these healthcare centers are large networks, such as San Isidro Health Center that has over 42 program sites, and Family Health Centers of San Diego that has over 23 locations throughout San Diego. So that means that I met with several key leaders, between 6 to 8 at some sites, with the purpose of validating the market supply gaps, opportunities, assess the training needs, and identify the essential KSAs, which is the knowledge, skills, and abilities for healthcare workers. Additionally, we discussed in-demand occupations, emerging occupations, and opportunities for work-based learning, clinical placements, internships, and many, many other subjects. I also recruited them to be part of panel interviews. And once I collected all this information, I worked closely with Tina from the Centers of Excellence to discuss the in-demand occupations and emerging occupations. So over and over again, as I was conducting these interviews, we keep hearing the great need for patient care coordinators. And so what we did is we conducted a focus group, and you can see all those entities highlighted in yellow participated in the focus group. We had 11 participants, and we had representation from Imperial Valley, El Centro, and San Diego County. So what is this patient care coordinator? Here are some of the job functions, but primarily they facilitate communication between patients, family members, staff, administrative staff, social service organizations, and other healthcare providers to ensure that the patients receive the medical care that they need. So they are familiar with community services, resources, and they make those available to the patient. So they also are responsible for referring these patients so they can go ahead and do the follow-ups, and they can receive the care that they need to receive. This is primarily very important because, as probably you're aware, clinics, specifically in this case, they are getting, they get credit points if the patient has good health outcomes. So these patients that normally go to these ambulatory care settings, clinics, they face a lot of barriers. So these patient care coordinators are key to make sure these patients are receiving the care they need. So where do they work? They work in ambulatory care settings such as clinics, NGOs, hospice facilities, insurance companies, large dental offices, and long-term facilities. And these are some of the job required duties, and I'll just let you kind of look, and I'll share this presentation with you, but for time purposes, I'm gonna go ahead and keep moving. So since this is an emerging occupation, there is no occupational code. So more research was needed, and the Centers of Excellence looked into this occupation further by looking at all these job postings and in all these different types of variations. That led us into finding out that the hourly earnings for patient care coordinators are above the living wage, and this is in San Diego County. But if you can see, they start at $16.88 and they move up to a medium hourly wage of $20.33, which is pretty good. And this is the online job postings for patient care coordinator jobs. So in terms of the labor market demand, the number of online job postings with keywords patient care coordinator between 2010 and 2019, you can see an increase from 574 jobs to 2,500 plus jobs. When they looked into just care coordinator, you can still see a little bit of upward trend, but it's not as much as patient care coordinator. So currently the workplace Currently in the workplace, the patient care coordinator occupation is above the medical assistant, medical secretary, medical billing and coding, which are foundational occupations. As you can see, there is two pathways. We have the nursing pathway and more on the admin pathway. And the patient care coordinator, we follow more into the administrative side, and it will be positioned above these three main occupations. In the focus group, participants mentioned that this occupation could be also great for pathway for medical scribes. And it can be also a great pathway for CNAs who decide that providing direct patient care is no longer for them, or they just want to do something that is less physically demanding. When looking at what will be the skills or the knowledge that they're going to need, pretty much here's a list of things that it will be required for an individual to possess in order to have this occupation. And we circled the cultural competency and patient advocacy skills because they mentioned that that is huge for that position. And they encourage that when students go through a program to get the certificate, to make sure they are very competent in these type of skill sets. Another skills, knowledge, and abilities that we collected from the focus group was that they require for individuals to have great communication, verbal, written skills, and to be preferable bilingual, critical thinking, problem-solving skills, medical terminology, billing and coding, high-level attention to detail, ability to multitask, ability to work in team environment, organizational and time management skills, basic knowledge of insurance coverage, insurance eligibility, sensitivity to the needs and situations of multicultural populations, resourceful, and of course, computer skills, Excel, Word, Outlook, PowerPoint. And I just want to kind of pause here for a second because I want you to kind of look at these skill sets that are needed, and pretty much these skill sets are needed across the board. So I thought it was very interesting how, you know, these are pretty much all the skill sets needed when we're looking at healthcare occupations. Currently, we have all these community colleges in the region that have these foundational occupations, and Imperial Valley College right now offers medical assistant, certified nurse assistant, and these colleges could be primed to be able to offer that occupation. And these are the recommendations that we made to all the CTE deans and to the deans to adopt and develop a patient coordinator program, to engage subject matter experts and faculty to assess current course content, to develop non-credit options, and to consider an online program to offer flexibility for incumbent workers. And this is very exciting because most of the pathway that heads into nursing requires a lot of clinical placement hours. And in particular in San Diego, it's not so much of a challenge in Imperial County, but in San Diego County, that is our bottleneck for our programs. So this is kind of exciting because it will not require those clinical placements. And well, that ends the presentation. Thank you. Any questions?
Outstanding, Ms. LaFuente. Thank you so much for that. We really appreciate that. That is quality information. I do want to add that we are going to have questions at the end of the session. So if you can stick around with us.
Absolutely.
Okay, great. Okay. And so now, ladies and gentlemen, we're going to go ahead and move into the panel portion of the event. And we're going to be hearing from a couple of different industry reps from various healthcare fields. And so very quickly, I'd like to ask if the panel can actually just introduce themselves really quick, stating your name, your title, and the organization you represent. We'll start with you, Ms. Kenney.
Good afternoon. My name is Lou Kenney. I am the Chief Clinical Officer, Chief Nursing Officer for El Centro Regional Medical Center.
Thank you. Next, Dr. Tyson.
Yeah, good evening, everyone. It's Dr. Tyson with All Valley Urgent Care in El Centro and soon to be Brawley.
All right, excellent. Thank you. Courtney.
Hi, good afternoon, everyone. My name is Courtney Kendall. I'm a clinical nurse specialist with Sharp Healthcare in San Diego.
Thank you. And last but not least, Dr. Martinez.
Good afternoon, everyone. I'm Dr. Alfredo Martinez. I am with the United States Navy Dental Corps. I work with the 2nd Dental Battalion here at Camp Lejeune, and I'm the department head of general dentistry at Osborne Dental Clinic.
Thank you. Thank you all. Okay, and so we're going to go ahead and kick things off. So Celeste, if you can go ahead and put up the slides so we can begin the Q&A.
So you guys can see the questions now, right? I'll go ahead and put present mode and then there you go.
Okay, so here we go. And so I'm going to go in the same order as the introductions, and it will be the same question for each panel member. And if you could just give your feedback on each one of these. We understand some answers may overlap, but that's okay, as we will reinforce the importance of all the information you have for us to the students that we serve. So let's go ahead and get started. Number one, Ms. Kenney, we'll start with you. What kind of skills do you look for or recommend employees have while working within the healthcare industry?
Well, here's my recommendation. If you have a desire to help people and to have a compassion and a commitment to wellness and helping the sick, this is the kind of the skills that I look for. It's really not skills, but rather an attitude and a behavior. If you are looking for specific jobs, then there's different programs that you would have to attend, anywhere from weeks or up to years of experience. So if you wanted to be an RN, obviously you can go to an IVC, which is a 2-year nursing program, to a 4-year nursing program. Either one would, and while you pass a national test, can get you an RN job. A licensed vocational nurse is a 1-year program and would be able to work as a nurse either in the hospital or in a clinic setting or a home health setting. And then there's MAs, medical assistants. They have a program. They can work in clinics and different, doctors' offices, very helpful. And then there's certified nursing assistants that are, just to name a few. I mean, there's many healthcare, occupations. And so it depends on where you feel like you would want to spend your time, in science or nursing, pharmaceuticals. So there's all kinds of things you can direct your attention to.
Excellent. Thank you. Next, we'll go with Dr. Tyson. Same question. What kind of skills do you look for or recommend employees have while working within the healthcare industry?
For us, it's we're an actual hands-on clinic. So number one is you got to have a willingness to help each other. I think we all got into healthcare, and I hope that we're all getting into healthcare because we want to have that relationship with our patients. So for us, it's patience, number one, a willingness to learn, because no matter how far you are in your education, we still have things to learn. Even I have things to learn, even with a medical degree. So that continuing effort to learn new things, be open-minded to being taught and being told, being open to being a team participant. Healthcare is an industry of team. I think we've seen that in the hospital. We see that definitely in the clinic where everybody has a role, everybody has a responsibility, and it's when everybody sits together and works together, helps each other out, that we see that those efficiencies go up and care improves. Eagerness, good attitude, personal relation skills, knowing you're dealing with patients who are sick, who don't feel well, who are scared, who are tired, angry, whatever it may be, having the patience to deal with them and really try to understand where they're coming from and trying to get to the bottom line of what those fears and concerns are, rather than just saying, oh, this patient's just rude. No, they're sick, and we have to understand that. So those are really the main skill sets that we're looking for when it comes to the urgent care setting.
Thank you. And next we'll go with Ms. Kendall. What kind of skills do you look for or recommend employees have while working within the healthcare industry?
So thank you for the question. I just want to give a little bit of background. As I'm an advanced practice nurse, and my role here at Sharp Healthcare is I oversee one of our entity's nurse residency programs. And those are nurses that have no nursing experience, that have just passed their boards and are transitioning over to becoming professional nurses. So when I'm sitting in on those interviews, I don't necessarily look for skills that I can teach you, but things that I can't teach you. So are you going to be caring and compassionate? Can you be a patient advocate? Will you speak up for safety? Do you pay attention to details? Are you flexible? You know, nursing, and especially in acute care and in the hospital, the environment is ever changing and it changes really, really quickly. So are you going to persevere, be able to overcome a lot of the challenges and still be dedicated to your patients and doing the right thing every single time? Again, just having integrity. You know, nursing is one of the most trusted professions, and so having integrity, knowing that you're going to do the right thing every single time, even in a crunch and in a really chaotic environment. So looking at skills that you have, and then we can help mentor you to grow those skills. But any other nursing skills we'll be able to teach you and to learn throughout school.
Outstanding. Thank you so much. And then finally, Dr. Martinez, what kind of skills do you look for or recommend employees have while working within the healthcare industry?
For me, there's two things that I look for most, and whenever I see, whenever I'm working with someone, and that would be the ability to care and also having a growth mindset. So there's a lot of things that people can learn to do given enough time, but that ability to care is something that I feel is very important, that is not addressed enough. So for example, there's nothing that brings me more joy to me whenever I come to work and I work with someone that cares just as much as I do about delivering the best dental care that I possibly can. That willingness for someone to take the time to study beforehand about the procedure, or asking questions, or even when making mistakes, trying to address them next time. Those are things that I'm looking for. I'm looking for growth. I'm looking for people that care, because there's nothing more that breaks my heart than working with someone that doesn't care as much as I do, because we don't feed off each other's energies and we don't deliver the best dental care we possibly could deliver. And that's not something that only I could notice. It's something that also the patient notices, right? So whenever there's this constant dynamic of learning and growing, that's something a patient clearly sees. And that's what keeps them coming back to you and building that trust between patient and doctor.
Outstanding. Thank you so much. Moving on to question number 2. Okay, go back to Ms. Kenney. Based on your research and firsthand experience, what are the local job opportunities within your industry and the entry-level wages for these positions?
Well, we serve an underserved area in Imperial County, and so the opportunities are huge, especially in healthcare. We always have positions open, whether you need to be a certified nursing assistant, a medical assistant, a nurse, whether it be an LVN or an RN. We have always opportunities for our local people, and we encourage people who really want to be in healthcare to come and work at our facility. So if you're interested, this is the career path you want to take, you will always find a job. No matter where you go, but certainly an underserved area where we could really use expertise in caring people. In terms of the entry level, it depends. Again, what you showed earlier in terms of wages for an MA and a certified nursing assistant, and those are what we are in that range. We do market analysis every 3 years, so we know we're in a competitive market for each position. There are certainly, as you have more requirements, licensure, certification, all of these things affect the type of wages for positions. So it can run the gamut.
Outstanding. Thank you. Okay, and now on to Dr. Tyson. Based on your research and firsthand experience, what are the local job opportunities within your industry and the entry-level wages for these positions?
For us, so we use medical assistants, we use front office staff, we use radiology MAs, we use lab techs, LVNs, and then we also use nurse practitioners as well as physicians. So there's quite an opportunity right now with us opening up a new clinic in Brawley on multiple positions that have been open. As far as paid, it really depends on what position you're applying for. But I would say that I think we're probably on the higher end of pay because as an urgent care, we're a little bit busier than most clinics. And the workload expectation is a little bit higher. But the reward to the pay is there.
Outstanding. Thank you. And on to Ms. Kendall. Based on your research and firsthand experience, what are the local job opportunities within your industry and the entry-level wages for these positions?
So for nurses, we are always in need for nurses. There's a high demand for nurses. Experienced nurses, that we have a lot of jobs. It's getting your foot in the door, especially as a new grad or a new nurse resident, we call them, with no experience. So that will be the hardest part, is getting that new grad position. And I just want to give you a little idea. So for Sharp Healthcare, we just had a cohort. We put all of our residents in cohorts, because when you're in a cohort with people that you do really well, there's camaraderie, teamwork, you go through the same challenges together. For our September cohort for 2020, we had over 1,000 applicants. And for Sharp Healthcare, we hired 78 of those 1,000 applicants. So there is a high demand for nurses, but just getting your foot in the door is going to be the hardest part. And our entry level wage as of right now is $46.23 as a brand new nurse coming in with no experience. And just a little bit what I would say, just from what I've seen, is I would try to get some experience. So working as an MA, coming in as a volunteer, a nursing assistant, get your foot in the door, get those, collaborate with, get to know people in the management level to help you further your career within the acute care.
Great, thank you. And finally, Dr. Martinez, based on your research and firsthand experience, what are the local job opportunities within your industry and the entry-level wages for these positions?
So my firsthand experience, although short, because I am part of the Navy, so I am constantly moving. Right now I'm in North Carolina. And from what I have seen on the civilian side of things, is that there is a lot of opportunity for jobs, right? Especially for someone who just finished dental assisting school or dental hygiene school. There definitely is that job market available. Now, what most people end up doing where I live is that they end up gaining 1 year of experience in private practice, and then they apply to work on base here on Camp Lejeune, which for most of them is the ideal job, not only because they get the holidays that all Marines and sailors get, but they also get a significant raise in their salary. So outside in town, I believe I asked one of the dental assistants I work with here, because we do work with civilian dental assistants. She got paid last year, I believe, $16 an hour, and now working here with us at Osborne Dental Clinic with a less workload, she's getting paid, I believe, $23 an hour. And this is her first year working under the military as a civilian contractor. So there's definitely a lot of opportunities, and it depends what kind of opportunities you want, what you're open to, whether you want to work in the private sector, whether you want to work in a federally qualified health center, or whether you want to work in a military base on being a contractor. So I think there's a lot of growth. There will always be need for healthcare professionals, especially dental assistants and dental hygiene.
Outstanding. Thank you so much. Okay, moving on to question number 3, and going back to Ms. Kenney here. What current or future trends do you see emerging within your field?
Well, as an acute care facility hospital, we are looking at, obviously, technology pretty much drives our work and our care for our patients. If you're in surgery, robotics is very big in terms of if you're going to have your gallbladder taken out or the prostate surgery. That robot surgery is very, very important as well. It reduces length of stay. It has a positive impact on your body. You feel better within a shorter time, and you get out of the hospital shorter time. AI, artificial intelligence, is something also emerging in healthcare. It's going to be huge as time goes on. And I think that we should look forward to doing that. Telehealth, with the COVID, obviously telehealth has become very popular. And I think that trend will continue. Although you will have to see your doctor or your nurse practitioner or your PA at times, but at least we have the option at times to do a video chat with your doctor and not have to probably leave your home or, take time off your job so you can go to see your doctor. So those are just a few things that is just about right now and what's coming up.
Great, thank you. And on to Dr. Tyson. What current or future trends do you see emerging within your field?
Within the urgent care setting, I think it's still this evaluation of COVID right now. I think is one of the biggest hot topics. We're looking at some software to kind of aid with the telemedicine, which is like the remote patient home monitoring systems. So we can get a little bit more information from the patients during these telemedicine visits. Most physicians like the hands-on approach. We need to examine patients. We need to see patients. And so there's still a disconnect, I think, with the telemedicine and getting some of the information with the physical exam. So there's going to be, I think, some trends towards innovation and technology using maybe different apps that are coming out to kind of go along with the telemedicine industry, as well as maybe even at home patient emergent emergent settings, not necessarily emergency where you should be calling 911, but maybe my cough's not getting better, and rather than going to the doctors, maybe we're sending people out to the home and doing those evaluations in person. I think there's going to be some trends and some kind of ingenuity trying into those areas and fields.
Great, thank you. And on to Ms. Kendall. What current or future trends do you see emerging within your field? Ms. Kendall, can you hear us?
It seems like she froze. Do you want to go ahead and go with Dr. Martinez?
Sure. Okay, sorry about that. Dr. Martinez, then I'll pass it on to you. What current or future trends do you see emerging within your field?
Going digital. Nowadays, technology is not really a luxury anymore at this point. It's a necessity by all means. And in my field, I'm seeing an increase in the amount of digital technology that we have. So whereas before, where patients were about to get, for example, a crown, some kind of an indirect restoration, we would take impressions of those teeth that we prepare with our hand pieces. Not anymore. Now we have things, for example, as CAD/CAM, digital dentistry, which allows us to scan the teeth without the need of those gross materials that you put on people's mouths. Now it's more comfortable, it's faster, it's more accessible, and honestly, patients love it for the same reasons that I just described. So going digital is definitely going to be the big thing in the coming years. And those practitioners and dental assistants and people who don't keep up are unfortunately going to be left behind. So it's just something that I keep seeing every day. For example, a lot of practitioners, dentists have groups on Facebook in which they meet and discuss and share different techniques, for example. And a lot of them are barely getting introduced to the concept of CTEAC and CAD/CAM. Okay. And not only that, we also have teledentistry, which was initiated at my alma mater, the University of the Pacific Arthur A. Dugoni School of Dentistry in San Francisco by Dr. Paul Glassman. Many people were really skeptical about teledentistry, but I think now with COVID-19, I'm pretty sure that it's something the school is seeing to make even bigger, considering that working from home is becoming more of a trend nowadays. And I think it won't necessarily become a norm, but it will definitely be a big part of the industry in the years to come.
Outstanding, thank you. And then Ms. Kendall, are you back with us? Not yet. Okay, then we're going to go ahead and move into question number 4 then. And going back to Ms. Kenney, what technology and equipment trends do you see emerging within your industry?
Well, I think as our my other cohorts have talked about, technology is a necessity, whether it's documentation or whether it's scanning someone for particular symptomology or disease process. The equipment is, whether it's getting smaller or more mobile, is what we're going to see. As somebody mentioned earlier, is that we will have more people will be wearing like Fitbits, so we have more that in information, not only for yourself, but you can transmit that information to your provider. So I think we're going to see a lot more mobile types of technology, and that your patients can provide information to you very easily to your provider.
Great, thank you. Okay, on to Dr. Tyson. What technology and equipment trends do you see emerging within your industry?
Yeah, I mean, I'm going to go back to kind of what I said earlier, and I think a lot of this is going to be the Bluetooth technology, digital, definitely. Because we use digital X-rays. I think we're going to be going to digital EKGs, pulse ox, Bluetooth compatible devices for home use. Again, remote patient monitoring. I think is going to be a big thing that we're looking at. We just finished a pilot with a company called Vitrac that is already on pace to start one of the largest home remote patient monitoring systems, where when you start to see these trends where blood pressures are getting out of control or pulse ox is dropping, it triggers an alert, gets a nurse to call so we can get the doctor on the phone right away. We're missing a lot of these cases right now because of COVID. Patients aren't going to the doctor, they're not going to the hospital. So we need to get a better idea of what's really going on at home. And I think these are the technologies and equipment trends that you're going to start seeing emerging.
Great, thank you. And then we'll move on to Dr. Martinez, because I think Ms. Kendall had some technical difficulties. But is she okay? Dr. Martinez, what technology and equipment trends do you see emerging within your industry?
Again, everything computerized. That's the way everything is going to go in the coming years. Not only because it's more reliable, but also because it's easier to transfer information as well, right? For example, in the Navy, we use one main system between the 3 branches in which we can exchange information in case we tend to see here in my clinic, for example, maybe a soldier passes by and they need a dental exam or they need some kind of emergency treatment. I know where to look exactly, what was done before, what is this patient's medical history, without them having to repeat the entire process for me to get to treating them. So it accelerates the process. And I think that's the thing about technology, that it helps us get better, faster, and more efficient, right? And people are attracted to that. They're attracted to new technology as well. So that's the way things are gonna be trending towards. And not only that, but also social media also plays a big factor in that. So, for example, in my field, dentistry, there's many ways in which practitioners, private practice owners can basically market themselves by posting perhaps some of the clinical cases they completed, some of the aesthetic cases, their outcomes, things like that. And patients can see that and they can say, I want to go to that doctor.
Great, thank you. And on to our final question. And I just want to remind everyone really quick, if you could please complete the industry surveys and evaluations that we're posting in the chat link. And also to our audience, we will have an opportunity for you to ask some questions if you have any to our panel and our presenter at the end of our session. But carrying on here, for our final question, back to Ms. Kenney. How has the COVID-19 pandemic impacted your position and your organization? And what future solutions do you foresee being implemented to reduce the impact of COVID-19?
Well, I think COVID-19 has made a major impact and how we look at how we take care of patients in the hospital, and how we could identify additional resources quickly whether it be beds in the ER or on the floor, how much ICU beds we can make, how we can use ventilators. All of that was impacted with COVID-19. So I think we learned a lot about how to manage the patients, and not only if the patient has COVID, but any patient going forward. And these solutions will take us far. Of course, telemedicine was one of those things that really advanced quickly, because that's what we could only get our patients, who are scared to come to the hospital or the clinic, and how we can make sure our patients are being taken care of. How we're going to see this, the one thing that I think we all can agree, it will take a vaccine or medications to mitigate COVID-19. We are in a vaccine trial. We start tomorrow, the AstraZeneca trial. So vaccines are going to be available in the Imperial County. So that's, we hope that has a promising impact. And so we invite people to go to that. And then, perhaps if vaccine is not, what medications are, like for HIV, we could not find a vaccine for it, but we found medications to help that. So that's what I think is going to happen in the next year.
Great. Thank you so much. And on to Dr. Tyson. How has the COVID-19 pandemic impacted your position and your organization? And what future solutions do you foresee being implemented to reduce the impact of COVID-19?
Yeah, that's kind of a loaded question. We actually got kind of put into this whole national discussion with the overwhelming amount of patients we saw here in El Centro since March. We figured out, it looks like, I think we probably figured out one of the best ways to assess patients when it comes to evaluating them outdoors, in person, using chest x-ray, both a serology test as well as a nasal swab, and an antigen test available to confirm the diagnosis sooner rather than later. Start treatment. I know there's been a lot of hot topic discussion about what treatments have worked and which hasn't. While we're waiting for the vaccine, we've been treating patients using hydroxychloroquine with Zithromax and zinc or doxycycline, depending on the age of the patient. We've treated over 1,900 patients with a 0% mortality. So why these studies and why our observations are being overlooked by some of the general public practitioners, we don't understand that. We've got over now 150 reviewed studies that show that this treatment is effective when started early. So hopefully what we're going to see is a future of getting a vaccine that's going to be safe and working, as well as using early treatment in the meantime while we're waiting for these vaccine trials to come through. I think that we need to really stand together as a medical community and get behind some of the physicians such as myself and Dr. Farid and Dr. Vo and Dr. Suarez, who are using treatment options, and we are seeing success with it. We can reduce the impact of COVID if we take the steps, all the steps, not just the contagion control steps, but using that early treatment, vaccines when safe and available, washing hands, staying away from the elderly and those who are at highest risk, what the hospitals have been doing with their isolation procedures. But I think we still need to come together more as a medical community and continue to support each other rather than trying to live in silos of this institution versus the other.
Thank you. Thank you. And on to Dr. Martinez. How has the COVID-19 pandemic impacted your position and your organization? And what future solutions do you foresee being implemented to reduce the impact of COVID-19?
It has severely affected the United States Navy and the Marine Corps as a whole. So even though our workload has been reduced, it there has been a fundamental change not only in the way we practice as a as a military branch, but also as a profession, the profession of dentistry. I feel like the profession as a whole had a moment of realization of wait, if COVID-19 is transmissible by aerosol droplets, doesn't that mean that we should always have been using N95s because of universal precautions? So those are very interesting questions that the profession as a whole is coming up with, because we as dentists, we work very intimately close with patients with their mouths open, with aerosols floating everywhere, and being with them for around an hour and a half, perhaps even more time. So we are exposed for large periods of time. And these are questions that are honestly should get addressed, especially during a time of a pandemic. What we have been doing right now is providing everyone with N95s. Unfortunately, there's not enough for everyone, so it's something that is still scarce. Um, but it has definitely taken a toll in the entire branch as a whole. And as far as solutions, um, the one thing that I can see the profession changing is that, not to call any doctor, any general dentist out there, but there has been a ongoing trend up until when COVID hit that a lot of general dentists in private offices were getting very lax, and it's not only private offices, also in the military, lax with universal precautions and proper adhesive dentistry. Now I know not everyone here is a general dentist, so just to explain real quick, what I mean by that is that whenever you go to the dentist and you get a restoration, a filling per se, most dentists, at least that I've experienced myself, tend to not use what is called a rubber dam. So it's a plastic thing that goes over the tooth to isolate it, or an isolite, which is it looks like a little fishtail to basically suck in the saliva and all the water and aerosols being produced while the operation is going. So that means that without those two pieces of equipment, you basically have all these droplets of saliva floating everywhere and relying solely on a high speed suction, which is not oftentimes not enough to basically suck up all the aerosols being produced. So it's just something to keep in mind, especially for my profession, just the fact that perhaps now things like rubber dam and proper isolation with dentistry is going to be a must more now than ever, rather than an optional equipment.
Thank you, thank you. And that was the final question. And to our panel, we sincerely appreciate you taking the time out of your busy schedules. We know that this is we're in a health crisis right now, but we thank you for continuing to serve our communities, patients, and advancing medical care. We're hoping that you can please hang with us for a couple of minutes after the session, because I think we do have a couple of questions in the chat already for all of you. But at this time, I'm going to go ahead and turn it over to my coworker, Program Manager of Educational Services, Adriana Hernandez, who's going to briefly mention the industry surveys as well as the CTE website at IVROP.
Hi, good afternoon. Again, my name is Adriana Hernandez. I'm the Program Manager for Educational Services. So as you can see on the screen, this is our regional CTE advisory site. And you will find the link in the chat. In case you missed your general session last week, you will find the recording in the homepage. Here you will also find the date to other industry breakout sessions. Next week, November 4th, we will be having our public services breakout session at the same time, 3:15 to 4:15 p.m. Don't forget to fill out the session evaluation. This provides feedback for today's event and helps us improve these and other advisory sessions. Also, as Adrian mentioned, please complete our industry survey, because that one helps give CTE programs industry input on how to better prepare their employees. Before we adjourn the meeting and move on to the Q&A after session, I would like to take a moment to thank our Superintendent, Edwin Oberfeld, today's facilitator, Adrian Gonzalez, and working behind the scenes, Pamela Dominguez and Celeste Rodriguez, and the rest of our team for their wonderful work, as well as our panelist and our presenter. Thank you so much for supporting us in this endeavor. And thank you all to all of our attendees for joining us today. And with that, I'll give it back to Mr. Gonzalez.
And if I can just kind of give the final thank you here, Ms. LaFuente, thank you so much. I felt like I've known you for years and it's only been a few weeks, but you did a fabulous presentation. To all our panelists, Ms. Kenney, Dr. Tyson, Ms. Kendall, and Dr. Martinez, thank you so much for the work that you continue to do and for joining us today with thorough, beneficial information. To all of our instructors out there, our staff, our partners, stakeholders, everyone that participated, thank you very much. And my Dodger fans out there, great win yesterday. All right, that concludes our meeting, everyone. Thank you so much. Have a great evening.